Bilirubin and jaundice is a very normal finding in newborn babies. Bilirubin is the accumulation of a breakdown product in the baby's blood. Jaundice is what happens when that is elevated and it becomes yellow in their skin. So jaundice needs treatment if the bilirubin level gets really high in the baby's blood. If that level gets really high, it can cause harm in the baby's eyes, brain, and deposit in their skin. So we monitor it to make sure that it's not getting to those dangerous levels, and we'll treat it. If jaundice isn't treated and it is in those really high zones, it can deposit in the baby's brain and cause a disease called kernicterus that leads to long-term brain damage. Certain babies are more at risk for jaundice. Ones that are born early, preterm, late preterm babies, their livers just aren't working really well. They're used to the mom's liver working and helping to get rid of that bilirubin. We can assist that with the blue lights if needed, if the level is getting too high. But the most important thing is that babies are eating well, that is, taking good breast milk, formula, or donor human milk, so that they are making good wet and dirty diapers and getting rid of it on their own. So we measure babies' bilirubin frequently in the first day. We're trying to catch any babies that are developing jaundice early on to a dangerous level. We measure it with a skin check. It's called a transcutaneous meter, and it checks either the chest or the forehead level. If that level is high, then we'll check them from the blood. The way that we do that is through the heel stick. And those blood levels will be what determine whether they need phototherapy. Phototherapy are blue lights that we use to help get the baby's bilirubin levels down. The baby's bilirubin, if it gets to be too high and we're worried about it, we'll use these blue lights. It'll help the baby convert that bilirubin into a more easily excretable form that they'll get rid of in their wet and dirty diapers. Babies also need to wear goggles underneath the blue lights. The lights are really bright, and the babies have been in a dark environment for a long time. So we're using that to help reduce any strain on the babies or discomfort. If we notice that the baby's bilirubin levels are high or they're jaundiced in the hospital, we will treat the baby while they're in the hospital. If it happens in those first few days after taking the baby home, you can also be treated at home. If the baby's being treated in the hospital, we use both an overhead phototherapy and a blanket. They're really strong. It helps to get that level down pretty quickly. If the baby's being treated at home, they can use just the bili blanket, and it works, but it's not quite as strong as that overhead light. So if babies need phototherapy, we can usually treat it to a safe level within 24 hours. There's a few babies that continue to make more bilirubin and are jaundiced for longer than that. We need to keep them for a few extra days, but most babies we can treat them and send them home with you within that 24 hours. You can also take the baby out of the lights for about 20 to 30 minutes every 3 hours for some skin-to-skin time or for feedings. Parents should watch for yellowing in the baby's skin. The yellowing in the baby's skin will progress from their head down to their belly and their entire body. If you notice it's developing over their whole body, then that can be a dangerous level of jaundice. If the baby is darker skin toned, you can press on their skin for a few seconds, look underneath that, and see if it's yellow tinged. Also, you can check the whites of their eyes to see if they're yellow in the eyes. Any of those could be concerns that you'd want to take the baby to the pediatrician to get it checked. After the first 4 to 5 days, if the baby is making nice green, yellow stools, then they're getting rid of their jaundice on their own, and it's not a concern for us anymore. So many parents will ask if putting their baby in the sun is enough treatment. And we don't recommend babies to be directly in the sun because that also has UV rays and that can damage the baby's skin. We will suggest to put babies near a sunny window. Most windows have some protection from the UV rays, and it allows some indirect sunlight to help. And that will help a little bit with treating babies' jaundice, but it's not anywhere near as good of a treatment or as safe as using the blue lights that we have. Once a baby starts phototherapy for jaundice, we do want to monitor it pretty closely in those first 4 to 5 days to make sure that it doesn't bounce back, even after we get it to a low level. So if they've been on lights in the hospital, we'll want them to follow up with their pediatrician maybe the next day